Welcome to Healthy Living. Today we're here to talk about the newly constructed St. Tammany Health System Surgery Center. The Surgery Center is a 126,000 square foot leading edge facility. It's the most leading edge facility of its kind in the Gulf South region. So we want to talk about that facility today. It's located on Bootlegger Road, 16282 Highway 1085, and it's right next to our Paul D. Cordes Outpatient Pavilion. So today I brought two of my colleagues with me who are experts in surgery and will be working as part of the surgery team at the new surgery center. And they were kind enough to take time out of their day as they prep for the opening to talk with me about this facility and how important it is to our community. So first, I want to welcome Amy Wade. She is a director of pre-op and post-op at the Surgery Center and Extended Recovery. So welcome, Amy. Thank you so much for coming today.
Thank you for having me, Amy.
Yeah, very happy to have you here. And I was doing a little background snooping, and you just celebrated your 27th anniversary with the St. Tammany Health System. So congratulations on that.
Thank you.
So the Surgery Center is slated to open in early March, and we are getting ready for that. At the time of this taping, we haven't quite opened yet. The facility is just about ready to go. Y'all are putting all the finishing bells and whistles on it. So tell us a little bit about your experience first with St. Tammany Health System and specifically in surgery, because one of the things that is really important to the operations of this facility is the tenure and the experience of the staff. So can you share with us a little bit about your experience?
Sure, Amy. Like you said, I've been at St. Tammany for a very long time. I began my career on the night shift on the orthopedic general surgery unit and stayed on that unit until taking my new position here at the new surgery center in some capacity. I've been a director of that unit for 21 years. Before I made the switch. So we cared for all orthopedic patients and also any kind of wide variety of general surgery patients. And in addition, and early on in my career, we took care of pediatric patients as well.
Okay, so that's all going to dovetail nicely into what's going to go on at the Surgery Center. So we should qualify by saying that the St. Tammany Health System Surgery Center is a 23-hour surgeries that can be performed in 23 hours or less. So it is an outpatient surgery center. That's what it's intended to be. It does have other features in case you need that extended stay, but we'll get into that a little more in a little bit. So in your role as the director of pre-op and post-op, let's talk about some things that you want people to know about the new surgery center as far as pre-op and post-op, the services that are necessary after you do have surgery. So what does your team do?
I want the community to know that we have some of the most experienced RNs on our team that have been at St. Tammany for a very long time in various roles, including critical care, the emergency department, and various adult health units throughout, even specialties in pediatrics and the NICU as well. So we're bringing a team together who's going to be able to provide safe and efficient care to all of our patients throughout the perioperative process. We want you to feel safe and at home and relaxed, knowing you will be in good hands throughout the process.
So when you come into the surgery center, when you come in to have surgery, if you walk through that pre-op area, everyone has their own little space. You're not sharing a room with anyone, and there are some features in there to help keep you safe. Like you said, we have the indigo blue lighting that is located within every restroom within the pre-op and throughout actually the facility, and that helps to keep everything sanitized and clean. So that is a good feature of the pre-op and the post-op area. So what does that look like? So when you talked about your experienced team, tell us about the people that they're going to meet when they're being taken care of before they go into surgery. So
well, when our patients arrive, they're going to be greeted by a patient experience specialist at the front desk who will guide them through registration and then eventually to the RN who's going to be assigned to take care of them in pre-op. That person will get you ready for surgery and guide you back to the OR where the operating room team will take over at that point.
Okay. All right. And like you said, they're some of the most experienced RNs on the Northshore. They're a cohesive team. They've been working together for a long time.
One thing I want to add too is pediatric surgeries are about 33% of our population. In the outpatient arena, we have pediatric specific RNs who do a fantastic job taking care of our children and supporting their parents and their caregivers. We've dedicated space to them, so they each have the pre-op area and the post-op area both have dedicated rooms, and we call them pods at the nurses station, specific for peds, so they don't have to be intermingled with adult patients, and they have those specific nurses who really focus on the pediatric patient. They're also going to make sure that the family members and the parents feel safe in our care and that their child is going to be well taken care of.
Yeah, and there's popsicles. Okay.
We have a fancy popsicle machine.
And you can definitely tell the difference when you move from adult to pediatric, the postoperative recovery area. It's obvious that, you know, the children are going to be in that part of the part of the center.
Kid friendly.
Yeah. So I touched a little bit on the safety features. So we talk about world-class healthcare close to home, and that's what we deliver. So what are some of the safety features that I didn't touch on that will be in place to ensure the best experience for the patient?
And you did touch on the Indigo lighting that's in all the patient bathrooms, and that's the cutting edge technology. I think we're the first in the state, we'd like to say, that have this technology. So even when you're not in the bathroom or in certain areas, the Indigo lighting is doing infection prevention behind the scenes. So that's really a cool thing for us to have. We also have a nurse call system where nurses wear locator badges, so we can answer your call from wherever we are in the nurses station. And if we can't answer the call, it will be answered by one of our team members, so that you can get your questions or concerns answered in a timely manner, or in case of an emergency. We also have cameras in every recovery room that give us an opportunity to have a second pair of eyes by an RN from the nurses station during your initial phase of recovery. So we think that that's going to be help us make you feel safer during that process. In addition, we have CRNAs, which are nurse anesthetists. They're in-house 24/7. So in the event that we need a little bit more attention for you, if something should go wrong during the night or any other time during the day, so we have those special nurses in-house.
Okay, well it's a well-rounded set of care, and it's a beautiful facility. Like you said, leading edge, state-of-the-art, and even the layout is very efficient, especially for the pediatric patients. I think that we should say that the surgery center was obviously designed by architects and experts, and it had guiding input from you guys, the clinical people who will use the facility and who know what's important, where it's important to instill those efficiencies, particularly in the pediatric space. So there are efficiencies there so that the patients, they go directly into the OR. They're not, wheeled through some area that is strange to them. So little things like that are part of what make this facility leading edge. So as a clinical person who probably had some input into this facility, that we should say that it's been in the making for 5 years now, which is we're excited to finally open it and get it going. What would you say is one of your favorite things about the facility?
I would like to say the open spaces, the windows, the calming colors, and the beautiful art truly makes me feel like I'm working in a 5-star hotel with the best medical team in the whole world.
Oh, that's really sweet. That's
really
wonderful.
Excited about us opening really soon.
Yeah. Is there anything else you want to add?
No, I'm just proud of our facility, and I'm proud to be an employee at St. Tammany Hospital.
Well, Amy, we certainly appreciate you being with us today to talk about it and sharing your knowledge and expertise. So we will be right back with another guest, Mr. Brian Grissom, and he will talk to us about the surgery center from his role as Director of Anesthesiology. We'll be right back.